now finally reversed that decision. But what is the impact of a film like this in that country, and how does this change things, if at all?
Thank you very much. For me, this film, when I watch it, it's a duty of memory. You know, it's really painful to live with this, to live with such testimonies, and to see every day the situation is not changing. For me, I don't know, when it will be screening in Congo, I think it will help some more people to perhaps it will help to, how to say, you have to recover for their internal wound, and yeah, to remember what happened and what was done up to now. For me, it's nothing. Nothing. No justice. And victims, they're still crying for justice. Even to know how to responsibilize people who did such crime. No one. For me, every day when I see such film, because there was many films realized like that, I remember I'm in touch with such women. I know them. I know their name one by one. I know that small kids who are now teenagers and who have babies. I know that women who were forced to eat the flesh of their kids, and they are still living. So it's really painful. But I'm happy now it can be screening in Congo, and the people will have time to recover for this internal wound.
Thank you. So Thierry, can you share with us what some of the challenges of doing a film like this? I mean, it really had such incredible scope and breadth of filming with the soldiers, and it was truly incredibly powerful and very inspiring and beautiful. I've never seen Congo actually. But what were some of the challenges in doing this in a country that it really is not sort of facing up to this issue at all?
I am used to make films in Congo. I have already made a lot of films. I am used to the difficulties. I was arrested an incredible number of times. I was expulsed 2 times from Congo. I was in trial in Belgium by the generalship of the police. For me, it was not too difficult to realistically make this film, because I have the support, I have the support of the population. It was very easy with the doctor and his team and all his friends, like Chouchou, to know where I have to go and good people to meet, and all the women want to express their point of view. Trying the role of the resilience. But the objective of the film was to go dramaturgically from the dramaturgic situation for the woman, to the resilience, this is the 2nd chapter, and to the resistance at the end of the film. We want, at the beginning of the film, to have this line, to make a film, a positive film, and to show the difference between the landscape. It's a paradise. Paradise?
Paradise.
Paradise. It's a paradise country. And the reality that it's not a paradise. It's an enfer. It's a evil.
Hell.
Donc voilà, and 12 like colonne vertébrale.
Vertebral column.
Yes,
Spinal cord.
the history of a man, the story of a man that is marketed as a courageous man with conviction and empathy with the woman, the victims. And with the doctor, it's not difficult to make a good film because it's about characters.
I'd like to complete him. Really, when we started, I remember when we started talking about rape, sexual violences, it wasn't easy for men like Thierry Michel to come to Congo and make such a film. It wasn't easy, even for us who were there. It started in 1994, but we started talking about it in media in 1999. It was a kind of taboo. We had to keep silent. But as a women of media, as a journalist, we said, no, we have to talk about it. We have to challenge that silence. And that's how we started broadcasting to broadcast the testimonies of victims. And I remember the first time that we broadcasted the first testimony of a victim, it was a shock in the community. They asked us how we were talking about sex. Is it a problem of sex? No. Because it was a shame for the community, it was a shame for the family. The victims were rejected. And we received many feedbacks and we had to sensitize everybody to show that it's not a problem of women, it's not a problem of sex. It's a problem of all the community. And we had to mobilize all the media, the international media. We made a big campaign calling Challenging Silence, Women's Media Against Rape and Sexual Violences. We went to the ICC, International Criminal Court, in 2007. We testified in front of the American Senate and many activities. I worked behind the Dr. Mukwege. For me, he's an exceptional man. Can you imagine? You see on, you are screening a film, or for us, we had to record only testimonies. And I don't know how I was feeling. I don't know how I was feeling. But for him, he has to see with his two eyes. Really, he's exceptional. And I remember we could have 500 testimonies from victims. 500. But they were stolen.
I had a problem during the shooting. It was an emotional problem. I had a shock with the testimonies and a trauma during the shooting. I was unable to continue after. And in certain time when I see again the film, I have a problem in pleasure, I have some problem in calm. If I see again the film totally, after I am never to speak. Because this trauma is coming.
I just want to ask Susanna one more question and then open it up to all of you to ask some questions. And Susanna, you've been working, at PHR started a program there to actually bring the perpetrators to justice. And can you describe a little bit about what you're doing in Congo, what you started there?
Yeah, sure. So Physicians for Human Rights has a long history of working on the intersection of medicine and law, where we are working to gather forensic evidence to support prosecutions. And in the cases of sexual violence, obviously in order for the kind of court case that you saw a bit of in this film, if there is proper medical evidence, it's much stronger to win a conviction for rape. But as I'm sure all of you know, that kind of evidence, even in the United States, where we have a very sophisticated medical legal system, is very difficult. And in 2011, I traveled to Eastern DRC to kind of assess where the gaps were in efforts to prosecute sexual violence. And this was as a result of a direct request all the way back in 2008 from Dr. Mukwege when he came first to the US. And you saw a picture of him here at the UN at that time when Kofi Annan was Secretary General of the UN. He came to our offices in Boston and he said, look, I'm a surgeon, I've treated thousands of rape survivors, I've repaired their injuries, but they're just going back to their villages only to get raped again, and what we need is justice and we need your help. And it took us several years to get there and do that, and we developed a project that's now in its 4th year that involves bringing doctors and nurses together with the police, together with the lawyers, and then all the military magistrates who are sitting, usually hearing these cases, so that they're trained together and they understand one another's languages, because the language of law and the language of medicine is very different, and they don't understand each other. And on top of that, what we assessed back in 2011 by visiting several hospitals, including Pansy, this hospital of Dr. Mukwege's, is that the medical reports basically said nothing. And the police said to us, we can't bring these cases to court and win because we don't have evidence. And so we've spent now 4 years not only at Pansy Hospital, where our project has been based, but also in other health clinics and hospitals up and down this extraordinarily beautiful area that you've seen on the border of Rwanda, the Kivus, the North and South Kivu. Training, first of all, health professionals on how to do a basic head-to-toe exam, how to collect the evidence, document it properly, and to work with the police to combine that with a crime investigation, a scene of the crime investigation, which most people